Nursing 474, Population-Focused Practice, the Foundation of Specialization in Public Health Nursing. The objectives this week include describe specialization in public health nursing and community health nursing and the practice goals of each. Identify clinical community health nursing practice with population-focused practice within your community. Describe contributions made by early nursing leaders and their application in community health in a modern world. And lastly, discuss the core competencies of public health nurses. There has been a shift to protect and improve the health of Americans. Two things to note are the Patient Protection and Affordable Care Act and also the Managed Care. Benefits of public health practice include there has been a dramatic increase in life expectancy since the 1900s because of improved sanitation and control of infectious diseases. There has been development of population-based prevention programs. There's a potential to prevent 70% of early deaths in the United States. Public health has had an enormous impact despite limited funding. Public health nursing in America. The vision is to have healthy people in healthy communities. The mission is to promote physical and mental health and to prevent disease, injury, and disability. Essential public health services include assessment, policy development, and assurance. Public health, according to the IOM, is what we as a society do collectively to assure the conditions in which people can be healthy. To clarify the government's role in fulfilling the mission, the report stated by the IOM in 1988 that assessment, policy development, and assurance are the public health core functions at all levels of the government. The Core Functions Project developed a useful illustration, the Health Services Pyramid, which shows that population-based public health programs support the goals of providing a foundation for clinical preventative services. These services focus on disease prevention, health promotion and protection, primary, secondary, and tertiary health services. All levels of services shown in the pyramid are important to the health of the population and thus must be part of the health system with the health as a goal. It has been said that the greater the effectiveness of services in the lower tiers, the greater is the capability of higher tiers to contribute efficiently to health improvement. This was from the U.S. Public Health Service in 1994 and then again in 2008. Because of the importance of the basic public health program, members of the Core Functions Project argued that all levels of healthcare, including population-based public healthcare, must be funded or the goal of the health of populations may never be reached. In the spring of 2010, this council, funded by the Centers for Disease Control and Prevention, Health and Human Services, adopted an updated set of core competencies. The 72 core competencies are divided into 8 categories. In addition, the categories are listed on the slide. In addition, each competency is presented at 3 levels or tiers that reflect the different stages of a career. Tier 1 applies to entry-level public health professionals without management responsibility. Tier 2 competencies are expected in those with management or supervisory responsibilities. Tier 3 is expected of senior managers or leaders in public health organizations. The Institute of Medicine released a report in 2003, Who Will Keep the Public Healthy, which identified 8 content areas in which public health workers should be educated, and they are listed on the slide, to be able to address the emerging public health issues and advances in science and health policy. The National Public Health Performance Standard Program set the bar for the level of performance necessary to deliver essential public services. 4 principles that guided the development include developed around the 10 essential public health services, focus on the overall public health system rather than on single organizations, describe an optimal level of performance, and support a process of quality improvement. Public health nursing is a specialty because it has a distinct focus and scope of practice, and it requires a special knowledge base. It is population focused, with primary emphasis on populations whose members are free living in the community as opposed to those who are institutionalized. It is community oriented. There is a concern for the connection between the health status of the population and the environment in which the population lives, and there is an imperative to work with members of the community to carry out core public health functions. There is a health and preventative focus with public health nursing. The primary emphasis is on strategies for health promotion, health maintenance, disease prevention, particularly primary and secondary prevention. Interventions are made at the community or population level. Political processes are used as a major intervention strategy to affect public policy and achieve their goals. And lastly, there is a concern for the health of all members of the population or community, particularly vulnerable subpopulations. The population-focused practice versus individual-focused practice. Population-focused practice diagnoses, provides interventions and treatments are carried out for the population or subpopulation. There are different levels of prevention. They are primary, secondary, and tertiary. Population-level decision-making is different. It's concerned with more than one subpopulation. Individual-focused practice provides diagnoses, interventions, and treatments, and they are carried out at individual client level. Primary prevention is the public health nurse develops a health education program for a population of school-age children that teaches them about the effects of smoking on health. That's just an example. An example of secondary prevention is the public health nurse provides an influenza vaccination program in a community retirement village. And lastly, an example of tertiary prevention is the public health nurse provides a diabetes clinic for a defined adult population in low-income housing unit of the community. Population-level decision-making is different from decision-making in clinical care. For example, in a clinical direct care situation, the nurse may determine that a client is hypertensive and then explore options for intervening. However, at the population level, the public health nursing specialist might explore the answers to the following set of questions. What is the prevalence of hypertension among various age, race, and sex groups? Which subpopulations have the highest rates of untreated hypertension? What programs could reduce the problem of untreated hypertension and thereby lower the risk of further cardiovascular morbidity and mortality for the population as a whole? The figure on the slide illustrates 3 levels at which problems can be identified. The C arrow denotes the focus is on an individual person or an individual family in a subpopulation. Excuse me. For example, community-based nurse clinicians and nurse practitioners focus on individuals they see either in a home or a clinic setting. The provider's emphasis is on defining and resolving a problem for the individual. The client is an individual. The B arrow denotes the subpopulations. The individual clients are grouped into 3 separate subpopulations, each of which has a common characteristic. The A arrow denotes the entire community. Public health nursing specialists are usually concerned with more than one subpopulation and frequently with the health of the entire community. The core public health functions include assessment, policy and development, and assurance. So for assessment, they would participate and provide leadership for assessing community needs, health status of populations within the community, and environmental and behavior risks, look at trends in the health determinants, identify health needs, priority health needs, determine the adequacy of existing resources within the community, and engage in policy development. As far as the policy development, that is a core function and core intervention strategy for the public health nurse. It seeks to build constituencies that can help bring about change in public policy. Assurance, the core function for public health nurse. Assurance focuses on the responsibility of public health agencies to make certain that activities have been appropriately carried out to meet public health goals and plans. It includes the development of partnerships between public and private agencies. There is a difference between public health nursing and community health nursing. Public health nursing, remember, is community-oriented, population-focused strategies. It's community-based combination of population-focused, community-oriented strategies and direct care clinical strategies. Community health, on the other hand, applies to all nurses practicing in the community. Community-based nursing is the provision of personal care to individuals and families in the community. Because most community health nurses and many public health nurses historically and at present focus on providing direct personal care services, including health education to persons or family units outside of institutional settings, which is either in a client's home or a clinic environment, such practice falls into the upper right quadrant, which is Section B. However, public health nursing specialization is population focused and focuses on clients living in a community and is represented by the box in the upper left quadrant, which is Section A. The word specialization in community health nursing can span boxes A and B. This suggests that there is a need and a place for a nursing specialty in community health. The nurse in this specialty is more than a clinical specialist with a master's degree who practices in community-based settings. Section C and D represent institutionalized populations. Nurses who provide direct care to these client and hospital settings fall into Section D, and those who have administrative responsibility for nursing services in institutional settings fall into Section C.